To be blunt, we are back, and let's welcome very special guest. He went from DJ at the hottest hip-hop and R&B station in Connecticut, Hot 93.7, to doctor, healer, and so much more. And actually, my personal teacher. More about that later. My friend, Dr. Kevin Reese. What's up, brother?
Mr. Peezy, hello.
How are you?
I'm good. I can't complain.
Excellent. Welcome to the show. This is not your first time here, but we are here on a much different topics. Last time we kind of talked about COVID and a bunch of other things, and prior to the collapse, which, by the way, still blows my mind to this day. I still tell people about how much of that you called on the show before it happened.
Yeah.
Amazing. But now here we are today. You have brand new book out, Peace Over Pain. Brand new podcast out. That's right. Brand new clinic that you're running every Tuesday, if I'm correct, right?
Yeah, the clinic's open, and then we have a podcast to answer people's questions on Tuesday mornings.
That's absolutely amazing. So let's talk about peace over pain, because that's clearly the big topic here. Peace over pain. When I think peace over pain in my head, right, when I first saw the title of the book, I thought about, in my mind, I thought about maybe it would be more of something like along the lines of a mental over physical type thing. You know, tell me though, in your words, what peace over pain means to you.
The mental aspect is definitely 33% of it. The other 33% would be nutrition. And then the other 33% would be postural, meaning the musculoskeletal system.
So tell me more about the postural. I've been reading about that, and I saw you actually giving a live, you were in a clinic actually, and you were actually grading someone's posture and everything. As the guy was saying in front of you, you started calling out different things that you would change. Tell me more about how important that is and why.
Sure. So our musculoskeletal system is our structure. It's our vehicle. It's what we walk around with. It's if we didn't have it, we'd be in trouble. And we see a lot of seniors that end up in this type of trouble, right?
Right.
So posture is the position of the musculoskeletal system. A lot of people think it's, how you sit and whatnot, but it's really, when you're standing up against the wall, next to a wall, we can see with our trained eyes, postural therapists, what's going on. Are their shoulders out of alignment? Is their pelvis out of alignment? Things like this. And when your posture gets messed up, this basically puts you in a position for an injury. So a lot of athletes, for example, they're just running and they blow their knee out. They're not even hit or they don't fall down, nothing. It just happens. That's postural. And the other thing that happens when the posture is off is your whole metabolism changes.
Really?
And that's the big mind blower, because when that happens, now circulation slow. We have 11 systems in our body. And all 11 systems, or I should say all 9 systems, because 2 of them are the posture, musculoskeletal. The other systems are affected by that. Just as an example, if your shoulders are impinged or your shoulders are messed up, that can be blocking blood circulation to your eyes, and then someone could have eye issues.
What?
Just off of shoulders.
It's all connected that much, because for one, I'm well known for having multiple knee injuries as a former pro wrestler, I should say. I've ran into a lot of knee injuries, and I also know that, my posture is not great. Like, I know, like, I don't stand up straight a lot. I'm sitting here right now, I'm hunched over. I'm not sitting like you can see you sitting straight up, and I'm over here hunched forward. And you got me thinking about all this stuff now, how much that this affects. So you don't think about that on a normal day-to-day basis, man. And this is why the research and the stuff you put out is so incredible, because this is something people don't think about on a day-to-day basis. And when they come across these ailments, what do? They call their primary first.
That's right.
They call the primary first.
They go right to the medical monopoly.
Right. But like, what is the actual function of a primary care physician? I mean,
There is none. The only reason to have a primary would be if you have a birth defect, say type 1 diabetes or spina bifida. You know, if you were born into the world with something day one, you might need a primary. But, you know, the primary is the gatekeeper.
Okay.
They're the middleman to the pharmaceutical. They're the middleman to the expensive equipment. They're the middleman to their specialist friend down the street that needs to put their kids through college based off of your $40,000 needs. You're walking on $80,000, you know? And so your ticker, your heart, that's 100 grand. So you think about all this in terms of money. The medical monopoly is making, I mean, they're a $1.6 trillion industry, and they're collecting the insurance money off of people who just don't have the information. That's all it is. And so I didn't understand posture either, Peasy, until I fell into some pain, you know, and I had to find the solution. So, you know,
Tell me more about that if you don't mind.
yeah, sure. I mean, in my late 30s, I mean, my knees started hurting, my back started hurting, my calves went out at one point. I couldn't even drive for a few months. You know, you need your calf to drive.
Yeah, it's a muscle you don't even think about how much you use.
And, you know, the osteopath, the chiropractor, they had nothing. And one day I came across postural therapy, and in 3 weeks I was out of pain. So
Really?
it blew my mind, and I said, I'm going back to school. And this is after a 10-year career helping people with nutrition.
Right, because that was
So,
kind of your first thing when you first, when you first went off on your own, we'll say, the
mhm,
nutrition aspect was a main focus of your whole program,
that's right.
right? And now I see you've been moving on to this whole new world of postural therapy and all this stuff and clinical nutrition and all
Um,
these different things, man. And the
mhm,
postural therapy, I mean, that really was the piece. I'm not gonna lie, that kind of caught me so much about is that I find myself having so many issues, and I know I'm not speaking for just myself. You know what I mean? And you go to a doctor, and they half the time don't even believe the symptoms you tell them. I've seen so many posts, honestly, just since we announced the last week when I said you were going to be on the show. Right? It was so weird because after that, like Facebook was telling me something. Like they're listening. You know how I feel about that. But like everything that was coming up were people posting about going to the doctors with this. You know, I had this problem and I went to so many doctors and they couldn't find nothing wrong with me and they told me I was lying and this and that. Or they would, tell them to go take a couple aspirin, call them and come back the next day or something, something like that, and never getting the actual help they need, which those kind of things blow my mind because not only can you not trust the person they tell you you're supposed to be able to trust the most, which is your primary care doctor. You know what
mhm,
I mean? Like I didn't have one for years, and I was honestly, my wife was like pushed me to get a primary care. She's a nurse right now. You know what I mean? So like,
right.
oh, really have a primary, and I'm like, but but why? Like, in my brain, I'm like, but why? You know what I mean? Every time I go see them, it's nothing. It's either I get sent somewhere else to start. You know what I mean?
Right, right. Well, one of the big themes in the book is that we can take care of ourselves. And so if you get on a clinical nutrition protocol, if you do postural therapy twice a day, if you practice mindfulness, if you do what you're supposed to do, then you will have no reason to need this monopoly we call medical, unless you have an accident.
Right.
And if you do have an accident, that's their expertise. So let's give them credit there, right? Don't come to me to stitch up your wound.
No, probably not the best idea, but I hear what you say. Everyone's got a specialty, but that's why in my brain, when I think of primary care, I don't feel like that's not somebody who's a specialist. All
No,
right.
no,
That's somebody in my mind who knows a little bit about a lot. You know what I mean?
not even really. I'll give you an example.
Okay.
All right, cholesterol. Cholesterol is one of the most complicated things in health. People are so confused because we've been brainwashed in the 1980s and the 1990s of cholesterol causes cardiovascular disease, heart disease. It's not true. But I just had someone that came to me practically on her deathbed. Okay. She was a 17-year vegan and
Okay.
she was so nutritionally deficient. And so I got her on a protocol. I changed up her diet. And in just a few weeks, her health completely started changing. She started getting out of the gutter, right? I say, let's go get your tests. So she goes to the medical doctor,
right,
to run some labs. Her cholesterol is high. Now, keep in mind, her cholesterol was high before, too. And she
right,
couldn't
okay,
figure it out. She says, how is my cholesterol high when I've been eating plants for 17 years?
right. Doesn't make any
There's
sense.
no cholesterol in plants.
Right,
Right. So the doctor says, well, you should back off on the eggs and the meat and the fish. Just back off on the butter. Back off on all that. And she says, but doc, I just started eating this stuff 2-3 weeks ago. So the doctor right there, he's being called out. He's being called out.
right.
Unintentionally being called out. So he says what they all say. Well, it must be genetics.
That's bullshit.
But it's not true. There's actually two types of cholesterol. There's dietary cholesterol that you eat, and there's cholesterol that your liver makes. So if you're only eating plants and you have high cholesterol, that means your liver is overworking.
Yeah, a lot.
A lot. And so she was inflamed and her liver is putting out cholesterol because it's alkaline to put out the fire. The doctor doesn't know this because in his 10-year training, he was taught to prescribe statin drugs. And that's it.
Right.
And so we have millions of people on statin drugs. And we're still the highest country in cardiovascular disease. So that's enough proof for me or anyone with common sense to say cholesterol isn't the problem.
You would think so, right? So then, what ended up being the problem?
For her?
Yeah, like what? So she comes to you,
right? So she was still eating the poor four foods, which is in the book, and it's important to get off of these four foods. And these four foods will inflame you. And then the other thing is a lot of vegans become nutrient deficient.
Okay, yeah, I've read about that a lot actually.
And that's not to say that meat eaters don't get nutrient deficient either, but it depends. A lot of it depends on the gut. If your gut health is poor, then you're not absorbing the nutrients. So you have if I can use a basketball analogy, you have a 7-foot center blocking your shot and your nutrition is not getting in. And so when you have a nutritional deficiency, there's 90 essential nutrients. Each of them can cause up to 10 symptoms. So that's 900 symptoms from nutritional deficiency.
So how do you pinpoint then? I mean, that's a lot.
That's where the clinical part comes in. That's where we run labs. We run blood tests, urine tests. If we're doing the gut, we can run stool samples, things like this. But that's the clinical part. And that's what the primary physician does not know how to do. They have no idea. They check what? 3 nutrients, 4 nutrients. They check your calcium. They check your phosphorus. If you're lucky, they'll check your zinc. But they don't know nothing about selenium, lithium, copper. You can't go in there and say, hey, doc, can you check my essential fatty acids? They'll probably say no, because it costs too much money. The insurance companies have them by the you-know-what. So
Right.
it's a monopoly. The best thing you can do is, one, start taking care of yourself by way of this book, and two, earn as much money as you can, because when you have money, you can really take care of yourself, because labs are expensive. If you run your full nutritional profile, you're looking at $1,500 off the rip, just right there. And then the nutrients are going to cost money. Healthy food is going to cost money. You got to make more money. I tell people this all the time.
That's exactly the point, though, is that it's we're in right now, for example, we're in the midst of just about a recession at this point. The economy is terrible. It's expensive to eat healthy, far more expensive than it is to go into the frozen section of your supermarket and grab, whatever the hell you want for a few bucks a piece. If you're gonna want to go fresh, you want to eat organic, that's all gonna cost. And a lot of people are not making the money to afford to do that. So what do? They stop at McDonald's on the way home. They whip something up in the freezer, in their air fryer, whatever. I'm totally guilty of this. I mean, this is exactly that's the problem right now. So the problem is that when you're trying to keep this nutrition going, right? How do you maintain that? You have to make a bunch of money. But what about the people who don't have that option, or who currently, are not able to make that kind of money?
Well, at our clinic, we have a supplement system that gives you all 90 essential nutrients. It costs about $130 a month. I would say that is the centerpiece to your nutrition right there, because you're guaranteeing it instead of, you're playing the lottery with your food, because our soil is depleted. You don't know what they're feeding the animals. And to be quite honest with you, all the nutrition is in animal organs. And most people don't want to eat liver. They don't want to eat heart. They don't want to eat testicle. They don't want to eat eyeballs.
No way I'm eating testicle, bro. There's no fucking way.
You never had a bull testicle?
No, I have not had a bull testicle.
They're about the size of your phone.
Yeah, I seen it on a Fear Factor. It's about the last time I watched anybody eat a testicle. Was that old show with Joe Rogan, Fear Factor.
As gross as it is full of nutrition. I mean, big time quality, big time nutrients. But again, you're better off just taking the supplement. You get your 90 essential nutrients, and then you have to get off the poor 4 foods. And that's
you keep bringing
gluten, oil, fried, and fake. 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 Get it in the head.
Gluten, oil, fried, and fake.
When you get off these 4 food groups, you open up the absorption in your stomach, and you bring free radical damage or oxidation way down. That's what causes what we call in our clinic the sea monster. We don't use the word because it's the most frightening word in the human language. We call it the sea monster.
Okay.
If you want to avoid the sea monster, then you have to bring your free radical damage way down to make it 0 with food. You're still going to get it from the air and from your soap and your shampoos, but our supplements give you enough antioxidants to neutralize it.
So these supplements give you everything you need, and for $130 a month, I can pretty much guarantee myself I'm getting this stuff and not wondering.
Correct. That's if you get off the poor 4 foods. If you don't, it's not even worth it.
Not even worth it.
Not even worth it.
That's a big leap to ask a lot of people, though. That's hard. I mean, how do you substitute, say, oil? Wait, what would you cook with aside from oil? Like, what's your kind of regimen like?
So I hardly ever cook in a pan. I use the Instapot.
I love my Instapot.
Right. So you throw a trivet in there with an inch of water, and then you put your meat on top of the trivet, and then you can put it in there frozen, and you cook it for 45 minutes, and you don't have to use oil or butter.
Okay. But could I grill it though?
You could, but you'd want to put a tin foil underneath so that the flame doesn't hit your food. Once the flame hits your food, you're going to get free radical damage every time you see black on meat.
Really?
Yes.
So tell me more about what free radical damage is then.
Free radical damage is when fats become oxidized.
Okay.
A good example of that is when you cut open an apple and you leave it on your counter, it'll get brown in 30 minutes.
Really?
Right?
Yeah.
Same with an avocado.
Yep.
So meat and oils get oxidized and it turns into what they call free radical damage. It's just chemistry and it goes in your body and it creates inflammation. And if you have enough of it, it will create the sea monster.
So you're saying all this stuff leads pretty much to the sea monster?
Yes. Correct.
I mean, that's an intense thing to think about, though, on a daily basis. I mean,
it should be a good motivational factor, though, to protect
absolutely.
yourself.
No, that's what I'm saying. Like for me right now, I'm genuinely, that's got me thinking about all these things right now because I'm one of those guys. I'm always on the go. I work, I do this, I have a lot of on the road events. I got a 1-year-old, so I'm always running around with him, and it's always like go, 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 and it's never like it's hard. I find it very hard, honestly, to keep up with nutrition. I really do.
You don't have to. All you have to do is not eat four types of foods, and get on this drink. That's all you have to do.
It sounds so simple when you put it out like that.
It really is. Now, don't get me wrong. When people have other symptoms, sometimes we have to put them on a more advanced protocol. Like, for example, if somebody had gut issues, that there would be much more involved.
Okay.
Something like SIBO, where the gases are just lingering, the overgrowth of bacteria, diabetes, type 2 diabetes, it requires some more stuff,
Right.
but at the core, it's these 90 essential nutrients. And then we usually also get people on this other product that has a 16,000 ORAC. ORAC is how we measure antioxidants. And so we want to be ingesting 20,000 a day, but most Americans only get about 1,000 a day, 1,500 a day. You put that in perspective.
Yeah, that's nowhere near where you should be at then.
Nowhere near. And if somebody came to me with the sea monster, we're getting them up to 100,000 ORAC.
That's possible from 1,500?
Yeah.
Wow. And how long does a process like that usually take to get them, if they follow the program, to where they need to be at? That's a big
Man,
number.
you'll be a new person in 4 months.
Really?
Oh, yeah.
Well, Awkward Ginger, in the comments, she asked, isn't gluten in everything?
Well, it's in everything when it comes to starches. It's not in apples and oranges. It's not in, steak and potatoes. It's not in salmon and, avocados.
There you go.
Gluten is wheat, barley, rye, and oats.
So anything that contains that, you're going to have gluten in there.
Yeah. So what gluten does is it blocks absorption. And if you want to talk about the pandemic a little bit, notice that the gluten countries got nailed. India got nailed.
Yep.
You know how many people died in India?
Yeah.
It's astronomical. Why? Because they eat gluten and oils all day. They have a high rate of type 2 diabetes. Type 2 diabetes, it comes from nutritional deficiency combined with too much carbs. So, India is very vegetarian, but they're eating the poor for foods.
Right.
Italy got nailed. Gluten, oils.
Oh, yeah. That's all they're eating.
America, we know, got nailed.
Mm-hmm.
Right? Japan didn't get nailed. Okay, so gluten, these poor four foods, gluten, oil, fried and fake, gluten, oil, fried and fake, gluten, oil, fried and fake, they created damage in certain humans. And then this virus comes floating around and you're unhealthy and boom, you're in the hospital.
That's crazy to even think about, because when you put it in perspective like that, it makes a lot of sense.
And Peezy, that's why kids didn't get nailed either. A 7-year-old doesn't have as much damage as a 70-year-old.
Yeah. Right. Their systems are still pretty much new compared.
The 7-year-old has only been eating gluten for 7 years.
Yeah. The 70-year-old's being gluten plus everything else, plus probably drinking, everything that goes along growing up,
Yeah.
And they've already deteriorated their body to a point.
Right.
And that's honestly.
That's right.
Wavy Witch asked, could I ever go out to eat at a restaurant?
No, absolutely not.
Really?
So all our clients, we tell, don't go to the restaurant. And I'll tell you why, because gluten can be contaminated. Gluten can contaminate. So even if you order a gluten-free meal, there's gluten back in the kitchen. And believe it or not, it contaminates.
What?
And
so
so
all these places that offer like gluten-free bread, gluten-free, pizzas, gluten-free, whatever, it's
it contaminates. Yeah. So if there's gluten just 5 feet away, there's a good chance that it's going to come over to your food at least a little bit. So you're going to get gluten. And then they're always cooking with oils because oils are cheaper than butter. And plus they're frying. Plus you don't know what's in their food. You don't even know what's in their salt.
Right. You really don't.
Just the salt that's at the table. You don't know what kind of salt they're using. Are they using, because we want to use salt from the north because there's not as much plastic pollution in those oceans.
Wow. I just see, I would never even have thought about this.
Your restaurant is the pressure cooker. And I'm telling you, if you take that pressure cooker and you give it a nice hug and you say, baby, I love you, it will treat you right. You will make stuff in there that people won't even believe you made. When I go to a family function, I don't rely on the family food. I bring my little R2D2 pressure cooker with me.
No, fuck you do not.
No, you throw something in there. You throw a turkey or a chicken or a brisket in there. You turn it on and you let your family's place, you let the aroma fill up your family's place and they're all like, what's that? What's that? And then the steam comes out and the kids hover around and go, what's this? What's this? And the meat is so good.
So tender too.
No spices needed.
So you don't even season it at all.
Just salt. Just salt. You want to use salt so that you can digest it better.
Oh.
It's when we lack salt that we get the GERD and the heartburn and all that.
I have a big problem with like heartburn and acid reflux, honestly.
There you go. You don't have enough acid in your stomach. Your stomach should be like battery acid.
I struggled all day just from one coffee I had this morning. I literally, up until probably a half hour before we came on the show, from started about 10 a.m. I literally spent all day. I was like, "What? This won't." I'm trying everything. I took, milk, whatever I can think of. I'm just like water. I'm just chugging water all day. Nothing. It was the worst. And honestly, I do get it bad sometimes. And
yeah, so you have a gut thing. So a protocol awaits you.
I think I need to come see you for a visit.
Come by the clinic. Come by our Facebook group. We give tons of free info there, and we evaluate posture in there for free if anyone wants their posture evaluated.
I would love to know how you get in on that. Like how would me or any of the viewers, jump in on and getting it evaluated?
Yeah, you just come into the group and just raise your hand. We put out a new posture video every Thursday. So underneath, you just say, I want to submit, you know, and you can submit your photos to us, and we'll evaluate them for absolutely free.
That's incredible. That's a
Yeah.
great opportunity, honestly.
And the book, if you want the book for free, it's $20 on Amazon. But if you come to the Facebook group, Peace Over Pain Clinic Facebook group, just ask. We'll give it to you for free.
Really?
Yeah, why not?
I'm joining the group. I'm so intrigued, man. You literally blew my mind with all this stuff. And, because I don't obviously get to talk to a lot of experts on the show as far as, the medical side, but not like, the corporate medical side. We're talking about somebody who genuinely knows his shit and cares. And I've seen you help so many people, like so many people. What would you say is like your biggest achievement as far as like somebody who came to you for help that was probably in like a really bad way?
I mean, Kim is the most dramatic because, she had a tumor that was blocking the birth canal, and she was about to give birth in a few months. And, the doctors told her to prepare, get her affairs in order. In other words, you might not survive
Wow.
childbirth.
Yeah.
And, after a few months on a protocol, she, the tumor was gone.
Gone.
And, yeah, her kid is like 9 years old now.
Dude, holy shit. What?
Yeah.
Man, that's
it's on video too, being being a media guy such as yourself. I try to make sure everything's on video.
right.
That's just like broadcasting 101. You try to get everything, and I just feel like I got to collect as much proof as I can, case studies, because people don't believe in miracles.
Nope.
And so I'll tell you, man, we're not allowed to use the other C word, because the medical monopoly owns it.
Okay.
CURE, right? We're really not allowed to use that word. So I just call them miracles, because the body is divinely designed to heal. Just like the flowers come up every spring.
Right.
It's all just divine. Everything's just happens so perfectly. And your body is no different. It's us that self-sabotage ourselves and mess it up. And, if we give you the raw materials you need, in other words, a nutritional protocol, and we start doing some postural therapy with you and get your muscles functional, you don't need to hit the gym. You need to get functional. And once this happens, the body just starts healing. It just happens. You don't have to think about it. It just happens. Just like a cut. If you cut yourself, it would heal right up.
Right.
So, and I want to give a shout out to our very old quarterback, Tom Brady, who's out here playing at 45 years old. He also does postural therapy and nutrition.
Really?
Yes.
See, I didn't know that. That's awesome. That's why I look at him. And he plays. He's the man. He's the bar.
He's breaking all the rules, and he calls it pliability. But what he's doing is he's getting the muscles functional. So he's not hitting the gym going like this, getting his arms strong. He's getting the muscles functional so that the bones go back to where they're supposed to be. Because remember, and I say remember because you know this, you just don't think about it. Muscles move bones.
Right.
Your bones don't do anything. They're just your grid, Right.
It's true
Your
though.
skull, your skull doesn't move unless your neck muscles move it.
And now that you actually say this, I'm thinking in my head, I wonder if that's what made like DDP yoga so successful.
Correct. DDP Yoga, and I don't think he knew what he was doing.
I don't think so either.
He just created something, and he's an entrepreneur, and good for him. He's a great motivator. But yes, people with all sorts of ailments go do DDP yoga and they get better.
Isn't that kind of like a form of postural therapy?
No, it's not as protocol as
Okay.
postural therapy. But you see, the spine is a major factor in our health. In fact, in India, there's a proverb: you're only as healthy as your spine. And so anytime you do yoga, you're helping your spine.
Right.
And so your spine controls all your organs because it's all connected. It's like a circuit breaker. And so you have nerves that go from each vertebrae and goes out to your lungs, your heart, this, that, and the other. I just had a client with heart palpitations, and she couldn't believe that once we did the evaluation, which we call P-raise,
Okay.
she couldn't believe that, we saw her spine was curved. And we're saying, well, your heart palpitations could be coming from your thoracic spine. You could have a pinched nerve. And she's like, no doctor's ever said that. Oh my gosh, I can't believe it. It's like mind blowing to people because, again, they're going to the monopoly and they're going to a specialist, and that specialist zooms in. If you go to the knee doctor, he zooms in on the knee. He's not looking at your ears.
Nope.
I'm looking at your ears because your ears are connected to your knees. It's all connected through fascia. It's all connected.
Before I even let you go, how are the ears connected to like your knees and your ankles? Tell me more about that real quick because that's fascinating.
Yeah, all the muscles run into each other. They're all, there's 700 muscles. And then they're sort of linked all together through this other soft tissue called fascia. And it's all connective tissue. And so, you could have a tight back, and your feet could be, duck footed. And it's like, it's connected. Your ears, we use the ears as a marker for your head. So when we're looking at your P-rays, your photos, we can see your head position or your neck position by just looking at the ears.
Wow. Wow.
And so, a lot of people, their ears are way over here, but their ears are supposed to be on top of your shoulders. And everyone watching this, you can go to the mirror and just kind of glance a little bit to the side and see, are my ears over my shoulders? I dare you.
Mine are right now, I can tell you that. I think I need a new chair now after talking to you. Because I should be sitting like this, I guess.
Well, you can, after the show, find a wall and just pop your ankles up against the wall, the bottom of the wall, and then your butt, and then your back, and then get your shoulders back. And you'll feel how uncomfortable it is. That's how you're supposed to be. Because the wall is perfectly perpendicular unless the architect messed up.
Right.
But it's straight. So that is your baseline.
Damn, man. Incredible stuff. Incredible stuff. I don't want you to give all the secrets away. You guys, if you want to know more, check out Peace Over Pain. You can find it on Amazon right now, or you can join the Peace Over Pain Clinic Facebook group.
Yes.
And you can get a copy for free and also get yourself evaluated, which costs nothing, I imagine, right?
Nothing.
Send a picture in.
Yeah, we would send you directions on how to do it.
And then check out, of course, the Peace Over Pain podcast with you.
You just got to get half naked. That's the only thing, because we got to see your joints.
I mean, it's fine. It's to be your loss, You have to look at this. That's all. But I feel like I want to get evaluated.
Let's do it. You air it on your show.
Exactly. We can put it on the show. I think that'd be cool as shit.
Why not?
So we're going to talk more about that, man. Listen, thank you so much for coming on.
Thank you.
I just appreciate you. And every time we talk, it's just incredible. I love it. You're so enlightening. So thanks, man. Appreciate you.
Thank you, man. Thanks.
Take it easy. Dr. Reese, check him out on Instagram, Peace Over Pain Clinic right now. Give them a follow and find out more. Maybe you'll learn something. There was so much more I wanted to cover, but I feel the time was ticking already.